Thank you, Mr. Po, for your speech. And now it is my pleasure to invite our guest of honor, Dr. Lam Pin Min, Minister of State for Health, to launch Singapore Patient Conference with his opening address. Dr. Lam, please.
Madam Kay Kwok, Chairman of NHG, Professor Philip Chu, Chief Executive, Tan Tock Seng Hospital, Mr. Michael Po, Co-Chairman of Tan Tock Seng CareConnect Volunteer Committee, distinguished speakers, NHG board members, fellow friends, patients, community partners, volunteers, and colleagues, very good afternoon to a lot of you. I'm delighted to be invited to this annual Singapore Patient Conference, and I was told by Professor Philip Chu that this is the second year they have been organizing this, and he promised that it will be more to come in coming years. And it is also good to see so many pioneer generation or PG seniors in our midst today, some of whom I had the privilege to meet during lunch. I was also very inspired by Mr. Wong Si Meng, Mr. Michael Po, and Mr. Michael Wong, whom you have saw in the earlier video, as well as Pearlie. And they are very passionate about giving back to the community that they live in. They are ordinary folks, but with a wealth of life experiences. They lend insight and guidance to us, motivating us to move forth to achieve extraordinary things. Today's theme on celebrating life and celebrating health resonates with me in a personal way. Being a doctor, in fact, I have worked in Tan Tock Seng when I was a young registrar, allows me to be part of my patients' journey, to witness their personal triumphs of recovery, and to celebrate the joys of restored health and a new lease of life with their family. Episodes like this allow me to reflect on the relationships we forge with our patients and their family, be it on the operating theatre, in a clinic, or even in the emergency room. Healthcare professionals forge partnerships with patients and their families, together with a community of caregivers who include volunteers, social support networks, and community organizations to improve patient care. Patients of today expect more than just timely and safe treatment of their medical conditions. They hope for a provider who can also respect them as unique individuals with special care needs. I'm happy to observe that Tan Tock Seng has taken positive steps in the field of patient experience to transform the way care is delivered to patients by developing a cadre of care that respects the needs, feelings, and relationships of its patients. I'm also heartened to note that we are acknowledging the efforts of caregivers today. Many caregivers look after the needs of an aged or ailing loved one practically round the clock, a role that is often demanding and challenging. And with an increasing aging population, caring for our elderly takes collaborative efforts with the community, and I encourage all of us to play a part and work together on this. We do this by strengthening our partnerships with our community of volunteers. True to its founding legacy of giving, caring, and serving our community, the spirit of volunteerism lives on here in Tan Tock Seng Hospital, supported by its community of 25 volunteer and patient support groups. Sharing a common vision of adding years of healthy life to the people of Singapore, the contributions of more than 700 volunteers have made a difference to the lives of our patients and their families. This diverse group of volunteers, some of them patients themselves, come from all walks of life, and some who are amongst the audience have been tirelessly giving emotional support to our patients and proactively giving suggestions to improve patient care. I congratulate Tan Tock Seng Hospital for taking the lead to establish a hospital-wide committee to involve patients in co-creating an environment of healing and care. The CareConnect Volunteer Committee is instrumental in building a strong relationship between the hospital and the local community served by Tan Tock Seng Hospital. The CareConnect Volunteer Committee aims to provide a sounding board for patients' voices and participation in giving ideas for improving their care experience. Having experienced care firsthand at Tan Tock Seng Hospital, our patient advocates now serve as a bridge between the hospital and its patients, particularly in communicating feedback. We have seen the stories of Mr. Michael Wong and Ms. Pauline Wong, who have stayed true to the cause of volunteerism by unstintingly giving their personal time and resources to help and support those in need. You have seen in the video, I just want to elaborate some of the good works of these volunteers. Mr. Michael Wong, whom I met just now during lunch, is a recipient of NHG Exemplary Patient Award 2014 for his selfless contributions as a volunteer for more than 3 years with the Tan Tock Seng Colon Cancer Patient Support Group and TTSH. Despite the physical and emotional challenges of battling colon cancer in 2010, 76-year-old Michael channeled his experience into something positive by becoming an active member of the Colon Cancer Patient Support Group and helping fellow patients cope with the illness. He manned the support group's hotline every Thursday and conducted face-to-face counseling sessions at the clinics. A living testimony of how it was possible to overcome adversity through sheer courage and determination, patients and their families drew strength from Michael's experience and learned to cope better with their conditions. Michael readily volunteers in other areas within Tan Tock Seng and is also a familiar face both to our patients and Tan Tock Seng staff in the new pharmacy. I was told that this sprightly pioneer generation volunteer stays on to his feet for hours on end, serving patients and their family members in the pharmacy, often going to the extra mile to anticipate and attend to patients and giving constructive feedback to the hospital. I think we should give him a round of applause for his good work. Another very passionate volunteer, Ms. Pauline Wong, started her journey of giving and sharing at a very young age of 16 years old with the simple intention of just to help those in need. The mother of 4 grown-up children is a volunteer with many VWOs, such as Singapore Association for the Visually Handicapped, Touch Community, Singapore Cancer Society, Muscular Dystrophy Association Singapore, and Cerebral Palsy Alliance Singapore. Pauline's volunteer journey into healthcare began in 2011 when she started chaperoning elderly patients for their specialist visits to Tan Tock Seng Hospital. Pauline often takes on the role as a patient volunteer, an elderly befriender, and also an advocate. She looks after many of these elderly patients, helping them to navigate the complex healthcare journeys. Having witnessed firsthand on the delivery of care to the elderly patients, Pauline chaperones and spends a lot of her time in the hospital and regularly gives feedback to Tan Tock Seng Hospital to better improve its processes and deliver enhanced patient-centric care. As a result of her feedback, Pauline has seen visible improvements to issues which she has raised, such as waiting time for blood tests and timely replenishment of hand rubs. I'm not sure whether Pauline is here today. Is she here today? But nonetheless, I think she deserves a round of applause from us. So, through all these heartwarming stories of Michael and Pearlie, we hope to see CareConnect Volunteer Committee grow over time as future hospital improvement initiatives would be patient-led, enabling the hospital to become a true proponent of patient and family-centered care. This patient conference is a useful platform to hear and engage the views of everyone, from patients to healthcare workers, community leaders, and volunteers. We are constantly enhancing the way we provide care to build a paradigm where we are aligned with one vision and where patients' needs are attended to collaboratively. And I look forward to a very fruitful conversation and presentation by some of the speakers today, and I wish all of you a successful conference. Thank you.
Thank you, Dr. Lam.